Hello, class. Welcome to Human Anatomy Biology 361. This is spring 2024. Hopefully, we can have a smooth semester. I know the beginning's a little rough, but I made this recording for you just to kind of, make sure that we don't fall too behind. So I did want you to go through the syllabus and go ahead and go through this YouTube video that I've made for you so that you are all caught up for the first week. Um, Here is my email, depatel@fullerton.edu. My office is in the Kines building at 185 because I also teach for the kinesiology department. I teach motor control, also teach A&P for that department. My office hours are 12 to 1 for this class, but to be honest, I'm there from like 9 to 12, 9 to 1. I know some of you have lab during that time. That's why I put 12 to 1. But if you don't have lab during that time, I may have office hours for another class, but if I'm there, I would be more than happy to help you during that time. So don't worry about that. I'm there pretty much all day, Mondays and Wednesdays. Okay, so our class is from 8 to 9. But after that, I go straight to my office and I will be there from 9 to 1 until I teach the other class. Okay. A little bit about myself. 23 years as an orthopedic sports physical therapist, 21 years as a certified strength and conditioning specialist. I had my own clinic. I sold it a couple years ago to go into more academics. I still see patients. In fact, I'm seeing patients tomorrow. On the weekend, I go to patients' homes, so I still have clinical experience. I like to travel to India for guest lectures. Was on the student advisory committee at Chapman. I like to travel. I've been to India, Germany, Austria, Switzerland, Italy, Dubai, Costa Rica, Alaska, Hawaii, Canada, Malaysia, Singapore, Czech Republic. Where else did I go? Just recently, Liechtenstein. I don't know if you know where that country is, but it's between Germany and Austria, somewhere around there. All right. So let's get going here. I did write two children's books. It's called first one is called Fun Anatomy Facts with Freddy the Fox, and the second one is called Navigating Nutrition with Nina the Ninja. So simple books just to teach kids how to eat properly, fruits, vegetables, all the good stuff that you should know. And then of course the Fun Anatomy Facts is everything that we're going to learn in this class, but kind of down to the lower level for kids 6 to 10. So if you have brothers and sisters, nieces or nephews, and you want to give them a good birthday present, there you go. Fun Anatomy Facts with Freddy Facts. Well, maybe you might learn a thing or two. So there you go. And then, of course, all the proceeds I donate to St. Jude's Children's Hospital. So it's not for profit, it is just to help children fight cancer. So that's my philanthropic work, something that I enjoy doing. Okay. All right, so get to the good stuff, really. The syllabus is on Canvas. You will have access to it. There's my email, but when you're writing an email, please make it professional. Make sure to address me as Professor Patel, Dr. Patel, what course you're in, instead of, hey, I'm going to be absent today. Well, I have over 100 students, so unfortunately I won't know what that means unless you tell me specifically the name of the class course section, what day, that we meet. It will speed things up versus me having to send you a replay and say, oh, please be more specific into what class. I would appreciate that. Now remember, anatomy is fast-paced and difficult. Okay, so it's not something that you can just say, oh, we have a quiz Sunday, I'll study on Saturday. You're already behind. You have to, if you want to do well, you have to study a little bit every single day. I guarantee you that it will catch up on you very quickly. Okay. Grades, your final grades for the class will be determined by the performance on quizzes, exams, and the cumulative final. We'll talk more about that later. I'm not sure if it's going to be cumulative. It might just be from that. So I just put that on there just so that you are mentally prepared if it is. Now remember, you have lecture and lab. So if you look at the syllabus, 50% of your grade will be from lecture and 50% of your grade will be from lab. So if you don't do as well in lab, then you can make it up for a lecture or vice versa. So it is something that you want to consider, but do well in both and you'll be good to go. You can read this a little bit later. I just want to, all this is just stated, as I mentioned, on how to study. Anatomy and physiology is arguably the hardest courses you'll ever take. Study as you go, 3 hours per hour of lecture minimum. So if I'm giving you 2 hours of lectures, then you need to study 6 hours. I mean, I'm just being realistic. If you want to do well, if you want an A, which all of you should strive for, if you're going to go into medicine, if you're a PA, dent, nursing, you name it, you have to know this like the back of your hand. Anatomy is the foundation. And again, if you spend the time in anatomy, then all the other classes will be, I will tell you, that much easier. Physiology will be easier, the other classes will be easier. But if you struggle through anatomy and just go through the motion, then every other class you take after this will be even more difficult. Just my 2 cents there. Draw the structures if you're more visual. Lab will help you. Again, we have designed this course so that you have plenty of help and you get the information from different angles. It's just not mundane. You're just rinse, repeat, read over and over again. But there'll be hands-on, there'll be dissections. There's a lot of ways that you can learn anatomy. Okay. All right. So let's start with the real stuff now. And anatomy is the study of structure and relationships between structures. Okay, so this is what the class is about. The study of the structure and how do we relate between those structures. How does the heart relate to the lungs? How do the lungs relate to the brain? How does everything work together? Remember, when you start seeing patients, it's not going to be just like, oh, this is my heart patient. Okay, the heart is going to affect the brain. The heart is going to affect the lungs. So you have to know every system and how they interact to be a good healthcare provider. And I will try to provide clinical examples throughout the semester so that it's just not, here's what the material, this is what you should know. No, I'm going to say, well, why do you need to know this? Why do you need to know how the heart works? Why do you need to know how the lungs work? And then relate it to patient care. I think you'll be able to relate the information better, and hopefully I can do a good job of teaching that to you. Okay. Now, physiology deals with the functions of the body parts. So physiology will be, okay, now you know all the structures of the heart. Well, how does the heart work? Now, I will throw, obviously, I can't teach anatomy without teaching a little bit of physiology. So there will be a little bit of physiology in there for sure, just because that's just the way it is. Everything is interrelated here. Now, these 2 disciplines go hand in hand, like I mentioned. But let's start here. Okay. Now, in this class, we are going to learn all these systems, right? So we're going to learn about the integumentary system, which is skin, the skeletal system, the muscular system, the nervous system, the endocrine, cardiovascular, lymphatic system, respiratory system, digestive, urinary, and of course the reproductive system. So we will go through all these systems. It is fast-paced, but something that you got to know. Now, before we start learning, about the skin, before we start learning about bones, we just need to learn basic medical terminology first. So let's start with the planes of motion. I'll also have another video, kind of a lab that I've made, so you can also watch that video. But if you look at the 3 planes, you have the frontal or coronal plane, you have the sagittal plane, and you have the transverse plane. If you've ever had an X-ray, if you've ever had an MRI or a CT scan, sometimes these planes will make better sense to you if you're looking at the image. Now, briefly, X-rays we usually use for bones, look at fractures, anything serious. MRIs, we look for soft tissue such as muscles, tendons, ligaments. And then CT scans, we can look for brain, tumors. We can look for other things. Now remember, the radiation levels are high in CT scans and PET scans, so we don't just arbitrarily give everybody a CT scan. X-rays have minimal radiation, and how about MRIs? Do they have a lot of radiation? What do you think? Oh. MRIs use magnets, so there is no radiation. You can get an MRI every day if you wanted to. It'd be expensive, but you could if you wanted to. There's zero radiation risk with the MRI. Okay. Now the frontal is basically, if I were to take something like this and just cut me all the way down the middle, it would separate me from anterior and posterior. Anterior meaning front, posterior meaning back. So a frontal or coronal section separates anterior and posterior portions of the body. Okay, that's something good to know. Plane is oriented parallel to the long axis. That means right through here. Now, if I wanted to look at both lungs, if I wanted to look at the heart, if I wanted to look at all my organs, the frontal plane would be a great way to look at all those organs. Okay. Now the sagittal plane is if I were to cut it right down right and left this way. So basically it would separate me from the right side and the left side. That's called the mid-sagittal if it's right down the middle. If I'm slightly skewed to the right or the left, that would be called parasagittal. It still separates between right and left, but the difference between mid-sagittal and parasagittal is mid-sagittal is right down the middle, and parasagittal is just slightly skewed to the right or the left. Now, if I just wanted to look at one side, the right side, then the sagittal plane would be good. Now, the transverse plane is if I were to take a right through here and superior versus inferior. So it's cutting right through the middle here. Okay. So you want to look at the definitions. You definitely want to know what the difference between the frontal, sagittal plane, and transverse plane. Those make for great quiz questions. Speaking of quizzes, we'll have a quiz every week. So you want to stay on top of the material. I feel like if I give you a quiz every week, you don't procrastinate and wait 3 weeks to study the material. This way you have to study the material every week. I know it's a lot, but I think from a discipline standpoint, it will help you learn the material better. Now, the other thing we also want to look at is quadrants. So you have 4 quadrants, quad meaning 4. You have a right upper quadrant, a left upper quadrant, a right lower quadrant, and a left lower quadrant. Now what you want to know is you want to know, well, what organs are found in these quadrants? You'd be surprised, if I were to ask you, hey, where's your stomach? 50% of students will probably point to maybe the right side. They're like, wait a second, is it on the left side, right side? You got to know where the stomach is. Okay, so the stomach is in the left upper quadrant here. The liver and the gallbladder are in the right upper quadrant. Okay, in the right lower quadrant, you have the cecum, the appendix, small portions of the small intestine. And the reason why this is important is, let's say a patient comes in and says, oh, I've got pain right here. And you're like, oh, okay. Oh, it looks like your stomach hurts. And I'd be like, oh, hell, you didn't pay attention during the first week of class. Because no, your liver's on the right side. Your gallbladder's on the right side. Your stomach is on the left side. And your pancreas is posterior to that. Okay, so you want to learn where the organs are and in which quadrant. I'll definitely ask you on the quizzes. I think this is important. This slide is a good one to know. Now, if we want to be a little bit more specific, we can cut it into 9 regions as well. So if you look, we have the right hypochondriac region, we have the epigastric region, the left hypochondriac region, right lumbar region, the umbilical region, left lumbar region, right inguinal region, hypogastric region, and left inguinal region. Now these are a little bit more specific. So if I say, hey, which region is the stomach? Well, obviously the stomach will kind of mesh with the epigastric and the left hypochondriac region, right? So it kind of blends in this one. The liver, yes, it's in the right hypochondriac region, but it's also a little bit in the epigastric region because obviously the organs are large and they'll kind of blend in with a couple of regions. So if you look at the liver, let's just give it the liver. If you look at the liver, well, the liver is in the right hypochondriac region. It's in the epigastric region. It's also slightly in the right lumbar region, right? I just want to make sure that you know that the liver is not in the right inguinal region, right? So a good question could be, hey, the liver is found in all of the following regions except. When it comes to anatomy, when it comes to any classes where you take where there's a lot of information, professors usually like to use all the following except. I know students hate those questions, but it allows us to ask a bunch of information into one sentence and find the exception to the rule. So you can make your own questions that way. So if you understand the material, you can say, hey, the stomach is found in all the regions except. Okay, so those are good ways for you to learn the material. Quiz yourself. Get together with your study partners and do that. I would highly recommend making small study groups and helping each other out. Remember, healthcare itself is a team effort. You don't need to do this by yourself. You can ask for help. Help each other out. It's not like whoever gets the highest score is the greatest. You all can work together and get an A. That's what I prefer. Help each other out. Now, one thing you do want to know is what is the anatomical position? We always reference everything in anatomy based on the anatomical position because I don't want to say your right, my left, left. No, no, no. Everything is always based on this anatomical position. So what is the definition of the anatomical position? Well, it's standing erect with your feet flat, arms at the sides, supinated. So your palms are facing forward and your thumbs are out, or we call that lateral. Palms face and eyes facing forward provides a constant reference position. Okay, so if I say, hey, my nose is superior to your umbilical, then we always reference it this way. It doesn't matter if he's lying on his side, if he's on his stomach, if he's, lying on the ground after a gunshot wound. It doesn't matter. His nose is still superior to his umbilicus. Does that make sense? So it gives us a constant reference point. Okay. The fundamental position is everything is the same as the anatomical position except for the palms are facing towards the body. So that's the difference between the anatomical position and the fundamental position, which is something that you should probably know. Now, if you've taken medical terminology, you probably have learned all of this medical terms, right? So you want to know, hey, what if somebody says cephalic? What does that mean? That means head. Frontal is forehead. Orbital region is eye. Buccal is cheek. Mental, you would think mental is up here, but mental is actually chin. Meaning, so take a look at this and go through it and make sure. Obviously, if you don't know what it is, make a flashcard or write this down. Like the armpit, we call that the axillary region. Okay, now this one is interesting, the crural, which means leg. Okay, so maybe you don't know that. Now the other thing that people say is that, oh, my leg hurts, and they'll point up here. You have to be careful because really that's the thigh. The leg is technically from the knee down. Right? So this is something that you want to know from a medical terminology, because let's say I say, hey, patient comes in with a laceration or a stabbing to the leg, and you're like, okay, you're looking, you're like, I don't see it. Well, that's because that's not their leg. Their leg is from the knee down, right? So you were like, oh, I didn't know that, Patel. Well, there you go. That's why you take this class, so I can teach you that. Or the arm, right? Well, the arm is actually from the shoulder to your elbow. Right? And if you say, oh, my arm hurts, well, that's not really your arm, that's your forearm. So from a medical standpoint, this is why terminology is important. So you and I are on the same page and we want to know, we can pinpoint exactly where the problem is versus guessing, well, he said arm, is it my arm? Is it my right, his right, left? No, we have anatomical position, we have this medical terminology so that you and I, during the medical charts, we're all on the same page. And then in the back, we have, the thoracic region, the cervical region, the lumbar region. This is the sacral region. And then we have the crural area in the leg, calcaneal here. The back of the knee is called popliteal. Okay, so these are good terminology that I would know. Good quiz questions for sure. All right, so these are some terms that you should know. Superior meaning up, cranial meaning the head, inferior meaning down. Now, rostral versus caudal. What do you think rostral versus caudal means? Okay, now think about that. Okay, so these are good that you might want to look up. Now remember, if I give you all the answers, it's just like, oh, but if you have to look it up, then your brain's like, oh, I had to work for that a little bit. So look up what rostral means. Look up what caudal means. You probably know what anterior already means and posterior. But if you look at this, right, and you're like, I don't know what ventral means. Ventral, dorsal. Back here, lateral, medial. Okay, or proximal means closer to the trunk, and distal means further away. So let me give you an example. My hand is distal to the shoulder, right? Or my hip is proximal to the knee, meaning my hip is closer to my trunk than the knee. Okay, superficial is obviously on the outside and deep is inside. So let me give you an example there. My heart is deep to my ribs, right? So the heart is deep to that. And then ipsilateral versus contralateral. Ipsilateral means same side, and contralateral means opposite side. So if I have a patient that has injury to the right leg and right shoulder, that's ipsilateral. But if I have a patient that has injury to the right shoulder and left hip, that's contralateral. You see? So those are some things that you definitely want to know. These are easy quiz questions. I'm just trying to get you an introduction to medical terminology and anatomy. So hopefully that helps. Just to kind of give you an introduction to anatomy. And then you can always watch this over and over again and then go from there. I gave you some examples here. Anterior toward the front of the body. The sternum is anterior to the heart. So that would be good quiz questions, like true or false questions. So again, I won't go through all this. I don't want you, I don't want to bore you with just reading this over and over again. But here you have access to it. And here I gave some examples for you so you can learn that. Here's rostral. Here you're like, okay, toward the forehead or nose, the forebrain is rostral to the brainstem. Okay, so toward the forehead and nose. Caudal means toward the tail or inferior end. The spinal cord is caudal, okay, inferior toward the tail end. Now remember, we can also use this terminology with animals. So rostral and caudal we can use for dogs or cats. So those are some things that we want to, we want to be on the same page there. All right. Here's some more examples of lateral, distal, proximal, contralateral. So again, if you need a little bit more practice, I've made these examples so you can see that. And you can make your own example. Tell me what's ipsilateral. The liver is ipsilateral to the appendix, meaning it's on the same side. Okay. You also have these cavities, the cranial cavity, the vertebral cavity, the abdominal cavity. Okay, so you want to know, hey, well, what's in the abdominal cavity? Well, the stomach, the liver, my intestines. What's in my cranial cavity? The brain. Where's my heart? That's in the thoracic cavity. What's in my pelvic cavity? Well, the reproductive organs. My bladder. Okay, so those are some things that you want to know, the difference between the cavities as well. Okay, these are some more examples of quadrants and regions. What you can do is you can, white this out and then see if you can label that. Okay, so there's some active ways that you can learn this material as well. You want to be an active student versus passive. Passive, you just go to the library and you're just like reading this over and over again. Half of it's not going to get into your brain. But if you have a roommate or if you have someone that you can bounce this off you and say, hey, what quadrant is the liver? And the more your brain understands and it says, here's the same thing over and over again, repetition, it says, hey, you know what? They've said this 6 or 7 times. I better remember this. So the brain remembers repetition. But if you just look at it 5 minutes before a quiz, it's not going to work. Okay, so that's why I say several hours of studying per week if you want to ace this class, which I think all of you have the same capacity to get an A in this class. It's just all the extra stuff that I can't control, right? Work, family, multiple classes that you're taking. Those are things that you have to learn to control. But from a brain standpoint, you all have potential to get an A. You just have to put the effort into it. So I think you can all do it. Okay. All right. Thank you for listening, and hopefully that helps.